our last but not least presenter, Martin. So our apologies, Martin. You literally have 6 minutes before the session closes automatically. Kindly share your screen and start the presentation. Try to skip the context or the introductory slides and come right away as fast as possible to the key findings so that we can really hear also about your work. Thank you.
Okay, if Doc could just unshare her presentation so I can share mine.
I thought I had unshared. It shows now that I'm not sharing.
We still see your presentation, Dr. Malini.
Let's see. I'm pressing share. I'm pressing share and nothing is happening there.
Yeah. So we have 5 more minutes for Martin.
But Nandita, madam, really, if you can see this, can you see? I'm pressing. Here we go. I'm pressing the wrong thing. Thank you. I'm sorry,
right.
Martin.
Thank you very much.
Dr. Martin, I'm very sorry.
Martin, kindly take over. I'm handing over to you. And as this is now a time management exercise also, please go right away into the key findings.
All right. Can you see my screen at all?
Yes, Martin.
All right, just talk about, thank you so much for the opportunity. Because of time, I will rush quite a bit and make sure we be able to finish within the 5 minutes I have to do. Just for introduction, so I'm looking at the impact of poor water services on the incidence of COVID-19 and its implication on health of rural women in India. So the focus here is on India. And generally, we know that water is a big challenge in India. The access and the quality are very big issues, especially in rural India. But for the purpose of my presentation, I'm looking at how the issue of water is affecting the incidence of COVID and how it's affecting women. And I'm using a secondary data. Basically, I'm using secondary data to do my discussion. Research reveals that more women are dying from COVID as compared to men as far as fatality rate is concerned. Globally, men die, the fatality rate for men is higher than that of women. But in the case of India and a few other countries, more women are dying in terms of fatality rates. And this, of course, is an issue that is worth investigating. I'll be using the iceberg model along the line just to present some few ideas. But looking at the water situation in India in terms of access to water, you notice that the major source of water in rural India is tube wells and boreholes. That means that a lot of people have to converge around these water points to get water. And culturally, you look into my presentation, women have the responsibility of fetching water for the household. And this is an issue that is worth looking at. The slide I have here basically just shows us the incidence of COVID. The first graphs that you see, chart you see, shows that more men are infected by COVID than women, and there are so many reasons to that, but we're not going into that now. But when you look at the case fatality rate, you notice that the case fatality rate for women is higher than men, stands at 3.3% as compared to 2.9%. This is similar to other countries like Maldives, Nepal, and Pakistan. I'm sure these countries have very similar, cultural and other related similarities. We want to dig deeper into why this is happening. What is really happening? Look at the picture. You see a lot of women trying to fetch water at the same place. If women are responsible for fetching water to households, that means that during this COVID time, when we need a lot of water to wash hands and to clean and make sure water sanitation is well up to speed, then it means that more women are going to be more exposed to the COVID infection. The challenge with India and with other similar countries is that women have long life expectancy. That means they live longer. And because they live longer at old age, are not as strong as they were in their younger ages. And this also implies that they are more vulnerable and likely to die if they get infected. This may, in a way, account or contribute to why the case fatality rate for women is high. A lot more studies need to be done to, of course, unearth this. This is an iceberg model, I've tried to just demonstrate my key findings, and just starting from the top, which is what we are seeing now, the high rate for women of 3.3% compared to 2.9. This is what you see at the top, but underneath this are mental models, underlying structures, and patterns. Because of time, I'll not go into that, but I'm sure you can read what's on the screen. Okay. Key findings. So yeah, key findings. So basically, even though both men and women need to give attention as far as COVID, incidence and mortality is concerned, there's a need to give greater attention to women as far as the Indian context is concerned. Also, it's also clear that there are many factors that are contributing to this, which includes cultural, financial, institutional. And so for us to be able to tackle this, we need to approach it holistically to make sure that we reduce the incidence of female mortality coming out of COVID. And also, apart from that, there's a need to collaborate. Various stakeholders need to collaborate, not only from the water sector, the health sector, the financial sector, various institutions need to collaborate to make sure that this incidence of high mortality of women as a result of COVID, which is linked to water, is addressed. What's the relevance of my presentation to this whole thing? The theme, the summit looks at a number of themes, and I think my presentation relates to society and culture, health and nutrition, and security. For society and culture, I'm looking at the cultural aspect because the cultural factors influence the role of women as far as water and sanitation for the household is concerned. For health and nutrition, we are looking at the impact that this is having on the health of women, rural women, especially in India. And in case of safety and security, you are looking at water security. Water security basically looks at the availability, the quality, and the access. And this is a big challenge as far as the spread of COVID and the impact it has on women in rural India. So basically, that's a summary of what I have. I'm going to do a more empirical study on this same subject in my in my main PhD research topic, which is displayed on the screen, which I don't need to read through. And I hope that we are able to make further findings to share with the academic community. Thank you very much.